Magnetoencephalography. To my knowledge, there's only 25 of these instruments in the United States. There's one at the Lexington Brothers Hospital. It checks the magnetic field around the brain. No intrusion of the brain whatsoever. We have two cases here where we show you that we are able, with an atlas adjustment, removal of an atlas subluxation complex syndrome, that we improved brain activity. To my knowledge, nobody's ever done this before. Improved brain activity and prove it. It's an imaging technique used to measure magnetic field produced by electrical activity in the brain via extremely sensitive devices such as superconducting quantum interference devices, SQUIDs. These measurements are commonly used in both research and clinical settings. There are many uses for the MEG, including assisting surgeons in localizing a pathology, assisting research in determining the function of various parts of the brain, neurofeedback, and others. To my knowledge, they're using it to locate tumors in the brain and for operations and what have you, to remove the tumors. This is the machine. The patient sits at the very bottom there, and it's got cooling devices in there. And we sent over a couple of cases, and at Lexington Brothers Hospital, they haven't been charging me for this research. And there's Dr. Jeffrey Levine, the brain research at Lexington Brothers Hospital. He says he's willing to work with me. The tests are $500 a test, and we already sent him a couple of patients, which we'll cover. Terminology: steady state visual evoked response or potential, SFVER or SSVER. SSVER reflect power changes at the stimulus driving frequencies that have been used to assess brain activity reflecting cognitive processing. John with ADT, 19 years old male with ADT for his whole life, dorsal lumbar pains. His whole life, 19 years. He was probably born with forceps or had a hard head twist on delivery one way or another. Initial adjustment was 12/17/07. 2 adjustments were performed to present time to 3/16/09. That's 15 months. No complaints at the present time. He was only lost adjustment one time in all that time. He hit his head probably getting in the car or something. Overall impression of MEG study. On the pre-alignment testing, the steady state visual evoked response was mildly abnormal. There was apparently normalization of the post-alignment scan. In other words, an improvement of his brain scan. The RAND 36 study, he used 400 to 500 experiments throughout the United States and a few other countries. The bar is the average health in the United States. The red line is when he first came in here. A month later, it was in the green. All right, 2 months later, it is the yellow. See that? Now this was taken 10 months later. Not only do you have the improvement of the 3 months and the 6 months, 10 months later, I've never seen a case that had 100% recovery in using this research paper. 100% recovery in all 8 symptoms. That he's only lost adjustment once in all that time. He's enjoying perfect health after being an AD case at 19 years. It's only lost adjustment once. We took stress out of the base of the brain, and this is the potential of what the brain does to the body when you balance the head on top of the neck. Pittsburgh Sleep Index on the same gentleman. Look, as the numbers come down, there's an improvement in all 8 functions. 2 months. Christine with bipolar. 20-year-old female with bipolar for 5 years under medication. 5 years, taking medication for 5 years. Headaches, cervical stiffness, cold extremities, depression. All right, Christine reports 2 months after the adjustment. No headaches. 80% improvement in cervical stiffness. 80% improvement in blood circulation in her feet. No depression. All right. She was still holding her adjustment after 2 months. That's one adjustment. By the way, she didn't take any medication before she went for the MEG study, for 2 weeks before she went for the brain scan. Initial adjustment was 9/19/08. She lost her adjustment once in the 5 months after that, only once, but she is not on any medication for the last 5 months. After 5 years, she was on medication. Her symptoms have shown 100% improvement. MEG study. Remember, we got brain scans showing improvement. Abnormal sensory gating is sometimes associated with attention problems, especially increased distractibility. Impaired gating is also seen in some psychiatric conditions, including schizophrenia, depression, and bipolar disorder. Overall impression. The examination from 9/12/2008 revealed some mild impairments in sensory gating, which bipolar cases also exhibit. This was with a normal limits during the 11/14/2008 exam. Now we're talking about 2 months later. There was an improvement in our brain scan within 2 months using the MEG study. This was the gating before. This is the gating afterwards. That's their improvement. For those people who are engaged in this type of instrumentation, they would understand this. Dr. Jeffrey Lewine said there was an improvement, and he says a proof.